We're delighted to have Hakim Shahid Bukhari with us today. We're going to do an interview of about 45 minutes with him, and he's going to explain Unani Medicine, which he practices. He is a fully qualified naturopath, ND. He's a practitioner and educator based in the UK. He has many years of experience in traditional medicine, clinical practice, and teaching. He's the founder of the College of Unani Tib and Alternative Medicine, abbreviated QTAM, C-U-T-A-M, and has played a key role in reviving interest in Unani principles in the West, presenting them in a contemporary and accessible manner. Shahid integrates classical Unani knowledge with modern insights, aiming to bridge traditional wisdom with today's health challenges. And we're particularly excited to introduce a book that he has written called Foundations of Unani Medicine, which he'll be talking about. So, Hakim, please, would you like to start by just briefly introducing the word, the term Unani, so that people know what we're talking about before we go into the questions proper?
Yeah, sure. Thank you, Gillian, for the interview, and I'm happy to talk about my book and a little bit about Unani medicine. So I prepared some slides as well, if that's okay. It's an ancient system of medicine. The word Unani means Greek. Um, the and it's the Greeks took this medicine from the Egyptians, and they developed it further, and they had the theory of the four elements, the four humors. And the philosophy, the Greek philosophy of things being hot and cold and wet and dry, and the combination of those, they kind of identified that in individuals, in seasons, in foods, and the effects on us basically. And then later on, that sort of kind of when the Greek history, ancient Greek, sort of kind of disappeared for a long time. We lost a lot of the Greek works for a long time. And then later on in the sort of 7th century, when the next superpower, which was the Arabic superpower, they they had their own sort of Arabian medicine, which was like folk medicine, and they wanted to find out what else was out there, and they started translating works. So they translated Greek works into Arabic, and in many ways, a lot of the Greek's literature that we have nowadays actually via the Arabic translations. So they then translated those works into Arabic, and what else was available in the area, the Babylonians and Sumerians, and also the interaction between the Indians, and then they formulated a new system of medicine with essentially the majority of the philosophy from the Greeks, and they kept the sources, their attribution to the Greeks, so they named it as Greek Arabic medicine. And then they further developed this into their own inventions like distillation, which came from the Arabs, and many other chemistry, alchemia comes from the Arabs, and many other sort of surgery techniques. And so then this was the de facto medicine in the pretty much the whole world, other than China and India, then India later on. But and then the books of these scholars from Unani medicine were practiced in Europe up until about the 17th century, until there was divergence into the modern medicine, what they call. That's a quick.
Fascinating.
Yeah.
That sounds really incredible. So we look forward to hearing more about that.
Yeah.
Could you perhaps let us know, first of all, what inspired you to write this book and who your target audience is?
Yeah, I mean I'm going to discuss that, but one interesting thing is that I did a talk a couple of years ago with the GNC, and the video on the Unani medicine in more detail can be found on the GNC YouTube site, which we can put the link in later on, hopefully. But in regards to the book, basically teaching for a number of years in here in Manchester, and I found that the students were wanted some more information. There was a gap between what the academic texts were, like the Ibn Sina's work, and the other books that were available were very limited in English. I'm talking about. There's works other than in English, but in English there was the translations of Ibn Sina's 5 volumes, which is a bit difficult to read, 10th century text, or there was some small books which didn't go into much detail enough for my students. And that's sort of I would say, um, sort of want of repeating myself the same thing over and over again. I decided to write a book. It took about 3 years
Oh
to
my goodness.
after none with my clinical practice and my teaching. And I wanted to preserve the classical knowledge and also use for more modern practice and also to really can bring this wealth of information into sort of a Western audience because nowadays English is a de facto is basically the lingophile, isn't it? Really, it's a language that most the majority of the world can understand, and technology, and so I'm bringing this into English more into so more sort of a wider audience. Yeah.
I see. Thank you. And can it be obtained from Amazon, or should people contact your website to buy it? What would you suggest?
Yes, so they can directly buy it from myself at my clinic website, and then we put that link underneath. Or of course they can go through Amazon and there's also other bookstores they could buy it from. But if they buy it from myself, they get it slightly cheaper than they would get it from Amazon.
Oh, that's good to know.
Yeah.
Okay, thank you. So you've already briefly introduced Unani medicine, and I know you've referred us to the GNC video that you did previously, which we'll put into the show notes.
Yeah.
Is there anything else that you think would be helpful to introduce our listeners to maybe pique their interest in coming to visit you or referring their patients to you?
Yes, so it's Unani medicine is, I believe, still relevant to modern world, especially with the stress and chronic illnesses and emotional burnout. The conditions that people come to, and I'm sure they come to yourself, is usually chronic conditions. So they've done the rounds. So they've been through, the doctor and the specialist, and they still haven't found any joy. Eventually, they'll go to either a naturopath or they go to a TCM practitioner, and then also to a nutritionist, or they will go to a Unani practitioner because they haven't found joy or they haven't found a resolution. So, for example, if somebody is tired all the time, so if they do, as you know, if they do a blood test and they find nothing, and they say, well, there's nothing wrong with you. So other than say anemia or thyroid or something like that, for example, then yourself and myself will probably start looking at their diet as a primary thing. So Unani has like what we call the 6 factors,
Mhm.
and they call the 6 factors which we believe causes an imbalance in the system. So one of them is diet. So that's food and drink, meaning if they eat too much of certain foods or too little of certain foods. And that in itself is again temperament based. So, for example, if somebody says, oh, they feel tired or something, for example, and they will check on the internet, they say, oh, eat bananas, it's got potassium, it's really great for you. But for a Unani physician, that's not enough. So it won't be suitable for all temperaments. So if
Of
you're
course. Mm.
phlegmatic, meaning you're cold and moist, then having banana is going to aggravate your condition. Okay. So on the other hand, say other people say, oh, have some warming spices. So if you're hot and dry, warming spices is going to aggravate your condition.
How
So
can you determine whether a patient is phlegmatic or not? Do you need to actually see them? Do you need to see them in
yeah,
front of you, or can you see patients by Zoom as well and just work
yeah,
it out just as well?
we assess the client, and so we would sort of ask certain specific questions to where we have like the 10 parameters for us in terms of their frame, their hair, the way they talk, their organ reactivity, etc., etc. And from there we can assess their temperament, And then also the imbalance in the temperature. So somebody may be hot and dry, for example, may become more hot or more dry because they've been eating the wrong types of food. Or if I said to you earlier about the 6 factors, they might be exercising too much or too little, or they might be sleeping too much or too little, for example. And then based on that, we'll say, okay, there's the core temperament, there's a deviation which is causing this condition. So we try to bring them back to balance. Yeah. And the assessment is by questions. And also we can get a lot of information by asking about the urine, the stool, so a dark urine or light color urine, or also we check their pulse. So we can do the pulse. But after a number of years, you can get a lot of information just by talking with them, asking questions. So now after COVID, I have clients who are all over the country or abroad. So obviously I can't see them and their pulse or things like that, but we can make a good assessment from that.
You can make it. So what are the other 5 factors then? You've mentioned
Yeah,
diet.
yeah, good question. So we got the sleep and wakefulness. In other words, how much sleep do they get? Or if they sleep too much or too little. And again is desire driven, the temperament driven. So in other words, if somebody is hot and dry, they may only need 6 hours sleep. However, a phlegmatic person who's cold and moist, they might need more, 8 hours, 9 hours, something. So a phlegmatic person, for example, when they hear the alarm in the morning, they will try to switch the alarm off because they need that more sleep. Okay. A choleric person who's hot and dry, they will just wake up as soon as the alarm goes, or in fact, they can't even sleep, because they got a lot of heat in their body. So that's the sleep and wakefulness. Then there is rest and activity. Then there is sort of exercise, how exercise or how little exercise they do. And then there is retention and evacuation. So are they go to the bathroom too often, too little? Or they're sweating or they're not sweating. So these are the sort of factors and the emotional state, and also the environmental state. So emotional environment is probably the most key ones nowadays in the clinic. What we call they call them lifestyle factors nowadays, but the diet, the emotions, and the environment, meaning are they on the phone or play with their phone before they go to sleep and things like that. So we look at those.
It's fascinating. The emotional is the largest sort of factor then. Does that mean that you need to actually know the person well? Because people will inevitably, during their first consultation with you, keep quite a lot to their chest. They won't sort of disclose their actual character to you. That must be quite difficult. How do you work that out?
Yes, I think this is something that all practitioners kind of like have to deal with it in their own way, and it comes with experience and time. In terms of understanding what's wrong with them, what's happening is sometimes you just get over time you will able to track the questions to understand what they do. But in many occasions you give, if it's a condition you understand or if something that individual hasn't expressed themselves, you give them the first level of treatment and then you ask them to come back next month, and then you get a better, clearer picture, right?
I see.
And
Yeah,
and
so
so
it's like once a month, is it, that you ideally see people at the
it
beginning?
depends. Yeah, I prefer for them to come so once a month, but for some conditions, like for example, like irregular periods, they may have to take medicines for 2, 3 months, a couple of months before they ask them to come back. Or somebody who has spermatoria issue, or somebody who has oligospermia, in other words, they have very little sperm. They need to take the medicine for about 3 months before I can assess it. But most people, I would say every month, I ask them to come in and so I can make an assessment. But going back to your other question about emotions, over experience, and you've probably found this as well in your practice, is that most conditions are emotion driven. Uh,
Many of them, yeah.
Emotion is the
Mhm.
actual is it really, it manifests itself into a physical condition. Yeah,
And
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 we've
go
seen
ahead, sorry.
yeah, sorry.
No, go ahead, sorry.
And we've seen an increase in things like cancer, for example, and it's a huge increase. And we don't know why that is. It could be diet, it could be, well, probably is diet and probably other issues, but emotion has a big factor. Whether it's a TCM practitioner, Chinese medicine practitioner, or myself and naturopaths, I think there is a huge emotional factor to this.
Of course, we've seen changes over the last 5 years, haven't we, that have been
Yeah,
unheard of in history.
it
And
is.
perhaps they have something to do with it as well. But can I just ask you, please, you mentioned medicines a moment ago. Where do people access the remedies for Unani? Do they need to be compounded by you yourself, or are there Unani chemists, or where do they
Yeah.
come from?
That's a very good question. So there are what we call the standard Unani formulations. So over a number of years, over hundreds of years, people have made standard formulations. So we have a pharmacopoeia of standard formulation as well. So for example, one of the formulations we give for the digestive issues comes all the way from back to Galen, right? And it's called Galen's formula. It's for digestive issue. And that's what you talk about nearly 2,000-year formula. So
What's
those
that made from? Is it herbs or nutraceuticals, or
Oh, we
what's in
use
there?
herbs. Primarily, we use herbs,
Okay.
right? Primarily, we use herbs, and pretty much all of them. And so the herbs, we kind of prepare them in different forms. We prepare powders, pills, tablets, syrups, and ointments, etc. But we more so tend to use honey as a carrier in many conditions. The reason being is we can give a higher quantity of the herb, because if in a capsule form, you're going to get like what 500 mg, which is not that much. But if you want to give a higher dose, in some cases, honey is a good carrier for that. Okay, and also honey itself has a balancing effect.
Uh-huh.
Yeah, so we prepare and the formulations and yes, we can use standard formulations, but we need to, in many cases, adapt them because based on the person's temperament, even though some of these formulations have been made to be balancing, but in a number of cases, maybe more than so we have to prepare them, so we have to individualize them. Yeah.
Of course. Yeah,
And we
yeah.
do that here in the clinic.
Oh, brilliant. Well, do you have any more slides to show before I continue with a few
Yeah,
questions I
sure.
had for you?
As I said earlier, we have the core principles, which are the elements, the humors, and the faculties. Yeah. And then we diagnose, as I mentioned earlier, through pulse, urine, physical observation of the patient. And the treatment approaches are lifestyle factors. In other words, we ask them to adapt the change their diet. Most cases, probably half the cases, I just ask them to modify their diet. And if they're drinking Coca-Cola or Pepsi or something like that, that's not going to help them. You know, so or these burgers or whatever. So that's one of the key. I would say probably half of all the cases is just to change their diet. And then there are also regimental therapies, in other words, things like hijama cupping or some massage or hammam or going to the sauna or exercise or that type of thing. And in some cases we do give herbal formulations or prescriptions, or could be single herb or could be compound herb. Like it could be lavender, for example, as you know, it's called the broom of the brain. If they have sort of issues with mood, we might give them lavender. Um, and so in the book itself, I go into detail about all these things. I talk about the core therapies in detail. It's over 400 pages.
Oh
And
my goodness, fascinating. Yeah.
yeah, and I spend a lot of time on the diagnostic methods, and how to read a pulse and what you obtain from the pulse and urine, etc.
So this is required reading for students of your courses, I can
Yes,
imagine.
yes.
Yeah.
And I think other people would benefit from them as well. And
Is it available only in hardback or also as an ebook?
it's available in three forms. It's available in because I had students, I said, what would you want? Do you want a paperback or hardback? And so I had everywhere, some people said hardback, some people said paperback, some people said ebook, which I don't like ebooks. But
Okay.
however, I've created all three forms. Uh,
Brilliant. That's useful.
Yeah, I have to make everybody happy. And it's good for health practitioners, other naturopaths, I believe. They may learn something from here. People are just interested, obviously students, herbalists. And so, yeah, it's available, say, in Amazon or on my website. And we can put the link in the video below.
Yes, we'll put it in the show notes, exactly. Well, I was going to ask, please, what else would you like to tell us about Unani medicine that has changed over the years? Has it kind of moved in leaps and bounds to kind of catch up with how modern times have changed, or would you say it's still very similar to how it was thousands of years ago?
It's a philosophy. Yeah, it's essentially a philosophy. I train my year 3 students. I say, look, client comes in, they say, oh, I don't know what to give them. I said, well, you need to use logic. So in other words, you break it down. What's the temperament? Okay, this is the temperament. What's the temperament of the disease? So, for example, if somebody is a hot and dry, they would most likely get hot and dry conditions like skin conditions or eczema or that type of thing. If somebody is cold or and dry, they'll probably get cold and dry type of conditions. But it's possible that, for example, sciatica is a cold condition, yeah, in Unani medicine. So we would treat it with warming herbs. Yeah, a warming treatment. It could be massage, it could be hijama, it could be warming herbs. We have how we treat it doesn't matter so much, but understanding the problem, what the causation is. First of all, we have to understand what's caused it. Is it the way they're sitting? Is it genetic? Is it whatever the environmental factor, diet factor? First, we have to find that out. There's no point treating them when we treat the condition. However, the condition will come back because you have not understood what the causes are.
You mentioned, is it genetic? Do you actually do genetic testing, or how would you work that out?
Say that again.
You said, is it genetic? Do you do genetic testing, or how would you work that
Yeah,
out?
so we don't do genetic testing. So what I meant was that we believe the diseases are caused by the three main ways of seeing the disease. It's either genetic, in other words, they're born with a condition, like
Inheritance. You can look at the family history, I
yeah,
suppose.
yeah, anemia, sometimes anemic condition. It could be structural, yeah, meaning the scoliosis or there's a broken arm or something like that, yeah. Or it could be temperamental, humoral. In other words, the temperament has changed, the humor has changed because of the 6 factors, this lifestyle factors which cause that condition. So we have to, if somebody, for example, works as a blacksmith, they're more likely to get heat-related conditions because they're working near the fire every single day. Or somebody is a fisherman, they're going to probably get more water-related conditions. So that's what I'm talking about in this case. So that's could be the causing. It could be causing that they live in a very stressful home environment or a spouse situation or children situation or financial situation. We have to see
Yes.
all those factors in before we make a treatment. The person will, if you don't do that, the person may get better, but it won't solve the problem. We have to, I always get them to understand what's the cause? What's the
You
cause?
have to get to the root of the problem.
Get
Yeah.
to the root, yeah.
You,
So naturopath say root, what's the root cause?
yeah. You mentioned hijama as well, and I'm not sure that our listeners all know what hijama is. Is
Oh,
that
yeah, sure.
a therapy that you offer yourself within
Yes.
Unani, or do you work together with other practititioners?
Yes, I do
Opposite
that.
sometimes.
Yeah, so we have hijama, we have leech therapy, we have some sort of blood pricking where we lose some blood. We have hammam, we have massage, we have a number of different therapies. And hijama is one of the therapies. And we have to decide who needs hijama. Hijama is basically cupping, where we place a vacuum, a cup and create a vacuum on the set parts of the body, and then we when we remove that cup, that's called dry cupping. But hijama, what they do is after you remove the cup, we make very small incisions, very light, you don't feel them, and then you put the cup back on and remove some of the superficial blood from the skin surface. Essentially, what happens is we put the first cup, the blood rushes to the top, and then the body itself usually deals with it. But hijama has a more fast action because that soft blood that comes to the top, it kind of removes it. Okay. Now the issue is, who do you give this to? Now it's hijama or cupping generally. It's drawing, it's weakening, right? So it's for people who have excess of something and they have too much blood or too much something, whatever. And then you apply hijama. But if somebody is weak, they need something to be put into them. right? So fire cupping, if you want to do cupping, fire cupping brings something heat into the body. So you could do something like that. Yeah. Or you might give them nutritional food to bring something in there. So not everybody's suitable for hijama or
I
cupping.
understand. Yeah. You mentioned earlier Greek and Egyptian traditions. Do you find that certain cultures and people with certain legacies are more drawn to this medicine than those going
Oh,
to the sort of run-of-the-mill uh,
oh,
NHS GP in the UK who've been born here and grown up here, or I mean, is it suitable for everyone really from any
yes.
background?
Yeah. Yeah, absolutely. So really, I think if we take the picture out of the Unani or other way, let's talk about an individual who goes to a doctor, as I mentioned earlier, they're not getting better. So they go
Mm,
to a naturopath.
yeah,
Yeah. So if somebody told them, "Oh, you're not getting better," why do you go and search for a naturopath? Or why do you search for a a herbalist or a Chinese practitioner or
yeah,
etc. Yeah. So that doesn't stop anybody in individual. It doesn't. It's not ethnic center or it's not. It's health centered. People are ill. They will
yeah,
go to anybody to get better. Yeah. And most obviously more people know about naturopaths or dietitians or etc. etc. They don't know enough about Unani, but Unani is a very rich tradition. It comes under the three classical traditions: Chinese, Indian, and Unani. There's the three classical traditions. Yeah. So Chinese are 4,000 years of tradition. Indians are 3 to 4,000 years, and we have 4,000 years as well as of history. So it's a
my goodness.
very sophisticated system. Yeah.
Yeah. And how can people find out more about it apart from reading your book? Say, a layperson who'd like to find out more, whereas the book might be a little bit complex for them. Do you
Yeah.
hold conferences or have a sort
Yes.
of, do you divide out your outreach into for the public and for practitioners?
Yes. So I do like workshops
Hmm.
where I talk about temperaments and how to work out your temperament or temperament people you care for and or your friends or whatever, and so you can have a good have a healthy lifestyle. And then I also talk about certain conditions, like for example, I just did a talk actually uh, about mental health and Unani medicine. So Unani helps with mental health quite well, actually. People with just recently OCD, I did a talk on OCD, how Unani handles OCD, right? And other conditions like with anxiety or
Yeah,
depression is
yeah,
very, very, very effective for that. In fact, a lot of the conditions I deal with is emotional conditions, as you know, and
okay,
and uh, and then so I'd also lots of issues with women's health. So there is no real solution in Western medicine for women's health. The women are neglected a lot in Western medicine. I'm not saying everybody's saying, but generally speaking, there's no understanding of women's health. So they think, oh, menopause, the person is going through some emotional thing. But no, it's a serious, debilitating condition for women. Now, recently, last 10, 20 years, people are understanding that. But Unani handles it well, Chinese medicine handles it well, and I'm sure other traditions help these conditions. Then there are women who are menstruating, irregular periods, PCOS, endometriosis, all these conditions aren't treated very well. Surgery or removal of the uterus or partly removal of the uterus is horrendous. If you're a 30-year-old or a 25-year woman and your uterus removed, what
yeah,
kind of life are you going to have? But Unani and other traditions treat this really well.
yeah, fascinating.
Yeah.
And so, how many Unani practitioners are there in the UK?
In the UK, I don't have exact number, but there are a number of Unani practitioners.
Well,
Uh,
there'll be those that you've trained in your courses, of course, as well. Do they all go on to set up their own practice, or do
and
some of them run it alongside another modality that they also have?
Yes. So, for example, some people come and train with me and they're practicing other things, like, for example, psychotherapists.
Yeah,
So they will come and study with me, or there are GPs, or there are midwives, or nurses, or people who don't have experience. They'll come in, they want to know more about Unani, they want to understand it. and
Hmm.
study with me. And it helps them in their practice. And some of them come to study to become Unani practitioners, and a few of them have opened clinic. Some couple of students in London, up in the north here. But I have more students coming, and the college has been open for about 7 years. So.
Oh, fantastic. Is there a sort of list of Unani practitioners that people can refer to?
Yes, yes. So we're creating a list on our website, and it takes a long time to get people to build the confidence to open their practice. The
Of
whole idea
course.
is for them to do the 3-year part-time diploma, and then after that, we kind of nurture them to open their practice. So that the problem is that most colleges you do the qualifications, but then you panic because from the qualifications to opening a practice is a big jump. So we kind
Yeah.
of guide them that point.
I know you're a registered professional association with the General Naturopathic Council.
Yes.
Could you maybe tell us a little bit about what that means and what the benefits are for Unani medicine?
Yes. I mean, I'm registering with the GNC, General Naturopathic Council. I believe gives me a wider access to other traditions, because at the end of the day, it doesn't really matter what you practice, whether you're a naturopath, whether you're a Chinese practitioner or a homeopath. At the end of the day, we are there to help our clients. Yeah.
Mm-hmm.
And it all traditions have the same goal. The style might be different. And even Western medicine is fantastic for surgery and
Of course.
fantastic
Yeah.
for, we can't, as I say, throw the baby with the bathwater, because it's if people come to see me, they say, "Oh, I've got this XYZ condition." I say, "You need to see your GP. You need to see your doctor." Antibiotics is not always bad. It's got some lifesavers. Yeah. So, but back to the GNC, it's a broad organization, and it's like a platform for people to get to know about all the different practitioners practicing different traditions. So that's the benefit of joining the GNC.
Oh, fantastic. Thank you. Well, is there anything else that you'd like to finish with? A few closing words, or would you like to show um, anything else from your book? Or
Yeah,
yeah,
I could maybe share some pages from the book if that's
that
okay.
would be lovely. Yes, thank
Uh,
you.
what the body has an innate ability to heal itself. So what we do
Uh-huh.
is we just support the body, same as other naturopaths and things like that. All
Mm-hmm.
traditions do that. And then we got what we call the humors, the elements, the temperaments, the what you call the faculties, functions, organs. This is the body uses all that to balance itself. And we talk about elements. Elements is like a misunderstood term, unfortunately, because of the modern term of elements. This is not the same elements as periodic table, but it's more concepts. And then how the elements affect the seasons,
Oh, yeah.
the ages, a different age, whether your children have a different
Oh,
temperature.
I can see that makes it nice and clear. Yeah.
Yeah, so I've got to put it all together in one image. So image, I say, yeah, as Confucius said, the picture shows is 1,000 words, isn't it really?
Yes.
So then, this is about elements, a little bit discussion of elements. So I'm trying to show you. So we talk about these are all the concepts, yeah.
Mm-hmm.
So causes of diseases. What causes a disease? And what causes a disease in the autumn? What causes a disease
Yeah.
in the
I can see
spring?
you've changed the color of the top of the
Yeah,
pages, and that shows us sort of where we are. That helps for
yeah,
navigation, doesn't it? Yeah.
exactly. It's just that other people get lost and
Lovely.
get
It
lost
sounds
easier, get
nice.
lost.
Yeah. Yeah.
Yeah, and then once we understand the causes, then how to identify a condition, how to identify a temperament, how to identify. We then talk about the diagnostic techniques we use. Yeah.
We've now got on to blue, haven't we? Yeah.
We got into blues. So for example, Hippocrates says that it's far more important to know what person the disease has than what disease the person has.
Yeah.
So this is how we check the pulse. Exactly how I describe how the pulse is taken. I kind of break it down into the different factors, what the pulse means, and that the interesting thing in this book, what people might find is that. I have here, which is not so many other books. So So, for example, if somebody has a hot temperament,
Mhm.
what would the post look like? If somebody has a cold temperament, what would the post look? So cold temperament post will be small and slow. Yeah. So this table will explain. And then further on, I have a bigger table, and then I talk about conditions. So if somebody, how would you recognize disease of skin from the pulse?
Yeah.
How
Can,
would you recognize?
can people take their own pulse, or does it always need to be taken by
Yeah,
somebody else?
you can take your own pulse. Yeah, you can take the
Oh,
pulse. It's a bit tricky, but
fascinating.
it's a bit tricky. Uh, and but it's and then we talk about the drugs we use, with
Mhm.
in Unani Medicine and what they do. Each of them, which one causes dryness, which one causes heating, moisture, which condition do. So we cover all that. So it's quite intensive. It's quite a
Mhm.
lot of information in there, and so yeah, that's all I really have in terms of that.
What language was that was being used throughout the book? Is it all one
English.
language, or is it a mix?
Uh,
No,
so the la
I see that, but in brackets there was, is that
Yes, yes,
uh,
yes, yes, exactly. So the language is English, and I translate the words into English, and it all comes originally from Arabic,
Arabic?
and
I see.
but I put that in brackets. So those people who want to know more and they want to go to other books, it helps them to sort of link it.
I
Yeah,
see.
that's all.
Fascinating. Well, that was a wonderful introduction to Unani medicine. Thank you very, very much. And do put as much information as you can in the show notes so that people know both where to get the book and how to access your clinic and your teaching institute and anything else that you know would be helpful.
Great.
And,
Thank you, Gillian.
perhaps in the newsletter that we bring out regularly, you could mention any events that you have.
Sure,
That would be nice as well. And then we can highlight those to people while also giving them a link to this particular new video and to the old one.
sure.
So thank you very, very much indeed.
Thank you for
And
having me, Gillian. Appreciate
yes,
that. Thank
is there a new book in the offing, or is that enough
you.
for now?
I think this is enough for I took 3 years of my life. I actually wrote, started another book. I did about half of it and then I gave up. It just didn't have time.
It's too much, isn't it? Yeah, no, but that looks like a real fantastic piece
Yes.
of work. Thank you.